Welcome everybody to my talk on EMDR. Just a brief explainer so that you have the information to know a bit more about this modality, and if you're considering it, to have a little bit of a background understanding of how we do things. It's such a fantastic modality that I use, so always keen to create an opportunity to let people know what it's all about. Before we get started, just a little explainer on the picture, which is me in consultation. And what you'll see in front of me is a light bar, which has a light going from side to side. So when I'm doing EMDR to create bilateral stimulation with the eyes, I use a light bar. Traditionally, and what you often see is somebody using their finger. Before I get started, I'd like to begin by acknowledging the traditional owners of the land on which the Health Lodge sits, the Arakwal people of the Bundjalung Nation, and pay my respects to elders past, present and emerging. And also like to make an acknowledgement to my team at the Health Lodge. We're an integrated medical centre. We understand that health is and understanding illness is a complex process and requires lots of heads. So a shout out to my team who I get to work with and support my patients to come to a place of wellness. So EMDR, let's explore the acronym and let's get started with D, which is desensitize. So really the whole purpose of EMDR is to help desensitize those things that have got incredibly sensitive. And the way that things get incredibly sensitive, one of the ways that things can get very sensitive in our bodies is if we experience injury. So EMDR works with the idea and the premise that some of our emotional and psychological distress has come from experience of injury. And when we're looking for targets to work from in EMDR, we're looking for experiences where psychological injury has occurred. Now, one of the ways to think about this that gets it a bit clearer is to think about physical injury. It's a lot easier. So we can see the picture of this woman who was having a lovely time rollerblading, and she fell and she's caused an injury to her knee. So the event was rollerblading. The critical part of the event was having a fall, and the injury is now the really sore knee. And then there's a bunch of symptoms which she then lives with as a consequence of that sore knee. And they're the things that really distress us. Pain, being immobile, frustrated and distressed that we can't move. And psychological injury is really just the same, but it's a little bit more difficult to get our heads around because it's so amorphous, it's not as concrete. So the same thing, that we can go through events that will then create emotional and psychological injury. And it's the symptoms from those emotional and psychological injuries that we're living with. Stress, anxiousness, perhaps avoidance of situations that are kind of similar, having nightmares. So I just want to establish this framework that I work from, and again to kind of help me give it some concreteness, if you like, because again, emotional psychological injury is so hard to grasp, is to think about it just like alongside physical injuries. So there's an event, and EMDR is very interested in identifying events that have left an injury, and these injuries have stuck around and they create symptoms for me which become really the reason why we'll come to see somebody for help, because these distressing things just aren't going away. So R stands for reprocessing. And reprocessing, another way we can think of is like healing, perhaps re-healing. Ordinarily, our bodies will heal most injuries. If we accidentally cut our hand while we're cutting something in the kitchen, it's a small cut. Our body has all of the implicit processes and skill and ability to heal that wound. It's the same with emotional and psychological injuries. If we got a fright, let's say we're going through an intersection in our car and there was a near miss and we got a fright, that shock and that fright is an injury. But over the course of the next day or two, our bodies will probably process that. It's interesting, the word processing is something that we're all using these days. I just need to go away and process that. I just need to make some time to process that. I know I need to process that. So we're clear these days that our bodies and minds create the conditions and have the ability to process emotional and psychological shock. We call that healing. Sometimes, however, we are not resourced enough for the processing to happen all on its own. And in those sorts of instances, we need to bring other resources to the healing process to support those injuries to come to resolution. And we want those injuries to come to resolution because we don't want to deal with the symptoms anymore. These are the things that are stressful from day to day. So for an physical injury, like the woman who had a collapse on her rollerblades, we since found out that she broke an ankle, other resources are brought to the process. You can see in that picture, we bring a cast to the process. We bring crutches, so there's not much weight to the process. There is rest, there's putting the leg up. EMDR is exactly the same. We create the conditions where reprocessing can happen, but with additional supports in that process to help it along so it can come to resolution. And one of the primary things that we use in EMDR to help with reprocessing is bringing bilateral stimulation to it. And you can think about that as the crutch and the cast of our process to help create the conditions so that our body-mind can do what it does really well on its own, and that's to bring things to resolution and heal. So what's the injury? Well, one way to really think about emotional and psychological injuries is an unprocessed memory, or a memory that is stuck. Some of the ways we describe it is a memory that is episodic. And that means it's just in very specific detail and it's in the here and now. These episodic memories haven't integrated into a full memory or a memory that's fully connected with all the other memories and information and narrative we have in our mind. And there's a real risk with these very stuck, isolated, episodic memories is it makes experiences feel like they're in the here and now, that the negative belief, and that's another part of the injury when we are affected by events intensely. One aspect of the injury is we're left with a negative belief about ourselves, others, or the world that just keeps coming up really fast and really easily. It makes things feel like it's in the present and in the now. And again, these memories are very sensitive. So coming back to the desensitize, we want to desensitize those memories because at present they're incredibly sensitive and can be easily activated. And we want to process those, reprocess those to bring them to a place of resolution where these memories now are integrated into our whole memory network. There's an adaptive belief around it, and it isn't as sensitive. So we have the opportunity to respond rather than get triggered into stress really easily. So the final part of the acronym is the E and the M, which stands for eye movements. And these eye movements, as I mentioned, are the kind of critical scaffolding and support for the healing of emotional and psychological injury to bring it to resolution. And the eye movements do lots of really, really important things. One of the things that's tricky about processing injuries, emotional and psychological injuries, is that to do that successfully, we need to make that memory live in the system. So we need to activate it a bit. But one of the problems with activating these memories is that they're trauma-based memories. So with their activation, we also activate the limbic system and the amygdala and the sympathetic nervous system, or we might activate the part of the nervous system that shuts down. So we're trying to access the memory to process it, but at the same time we have to do that very carefully and considerately and create the conditions in which someone is still present and grounded and relaxed enough to go through that process. And what we say in EMDR, to do that successfully, and hence why I've got these beautiful little feet in this picture, is we need to have one foot in the memory and one foot in present safety. And that's what's incredibly important for reprocessing to happen successfully, to have one foot in the memory and there be some activation, so we're accessing that memory network so that we can create meaningful change in that neural network, while at the same time keeping one foot in present safety. And that's what the eye movements do. They support somebody to stay in present safety while also having a couple of other mechanisms to support the process of healing. So I'm going to explain those very, very briefly. What the eye movements do, or more broadly, bilateral stimulation, is they help the person stay in present safety by keeping them present in the moment. And the way that we do that is give the person an activity to do, which is follow the lights with their eyes. So their working memory, or your working memory if you participate, your working memory is activated to keep involved in an activity which is in this present moment. And with the successful relationship with your therapist, that present moment is in the room of present safety with the present safe environment and the present safe person that is supporting you through the process. So that's one thing that the eye movements do. The other thing that the eye movements do is they activate the processing mode of your brain. The time and place that our minds are working very busily sorting through the information of our experiences is during REM sleep. REM sleep is our deeper sleep and stands for random eye movement. So we understand then that one of the ways that we can really get processing going is to get that REM state activated. One of the things that happens in the REM state is random eye movement, our eyes moving from side to side. So we activate that state through the eyes and get the eyes moving from side to side with bilateral stimulation. Finally, to process effectively and process well, it's great to have the left and right hemispheres of the brain working together on the job, and bilateral stimulation is a really good way to get both the left and right brain activated and participating in the healing process. So I hope that explainer gives you some insight into EMDR. It is a fantastic modality. It incorporates lots of other modalities that we're becoming more and more aware of, like somatic therapy, like cognitive behaviour therapy. To some extent, exposure-based work, but is a lot more considered and careful. And in and of itself, EMDR has considerations about the neurobiological system that are unique to the modality itself. But an incredibly considerate, thoughtful, and gentle modality. if it's something that interests you, please go to our website, get in contact with me. There's lots of fantastic information about EMDR out there. It's a very interesting area and field to explore and understand. And look forward to catching up with you soon, perhaps. Okay, thanks.